This week on State of Texas.
It's not something that we feel like is a problem out here right now, but we want to be proactive.
A Texas school district making national headlines for how it hopes to make it harder for students to experiment with drugs and alcohol. Another Democrat enters the 2020 Texas Senate race. What history tells us about the uphill climb to regain control of that seat from an incumbent? And lawmakers approving tens of millions in new money for health care in Texas. What should patients and doctors expect? Hello, and thank you for joining us for State of Texas. I'm Josh Hinkle. We begin with a look at a Trump administration proposal to change who qualifies for food stamps and how it would impact Texas, a state where more than 1 in 10 people receive monthly benefits. The Center for Public Policy Priorities tells us the floor to get food stamps in Texas is 165% of the poverty level. That's around $42,000 for a family of 4. Under this new rule, that would drop that less than $34,000 for that family. An estimated 125,000 Texans could be cut from SNAP, the Supplemental Nutrition Assistance Program. And right now, Texans qualify for food stamps if they have assets like a car under $15,000. The new rule would drop the limit to $4,600. That would take out a bunch of people from the program, but we do not know how many. As Phil President explains, it comes as food banks across the state are noticing an increase in need.
The SNAP rule change comes at a time when local programs fight to keep up with a growing Central Texas.
Just living in 2019, job layoffs, cost of living, just bills, just everything, and then you have personal tragedies in your life that make a difference and change your income.
Charlotte Jackson helps support her daughter and new granddaughter. She came to the East Austin Community Resource Fair for free food. The Central Texas Food Bank, Central Health, and the Texas Capital Bank put it on.
When your stomach is full, then you can think clearer. You don't have to worry about hunger. Hunger won't be on the list.
Our area is becoming a more expensive place to live, scattering people in need across the region, says the Central Texas Food Bank CEO.
It's created a moving target.
Derek Chubb says in the past 5 years they went from giving away 28 million pounds to 47 million pounds of food.
Beef tenderloin?
But they didn't double the impact. That amount only allowed them to maintain addressing about 70 to 75% of the overall need.
Texas touting our statewide unemployment rate. However, we still have one of the largest poor populations in the country as well. So it's one of those, depends on who you're talking to.
And with new changes from the federal government, time will tell if organizations locally will have to continue to fill the gaps. For State of Texas, I'm Phil President.
Here's a snapshot of food stamps in Texas. Last month, more than 3.5 million Texans relied on the Supplemental Nutrition Assistance Program to eat. Nearly 2 million were under the age of 18. More than 250,000 are 65 or older. A fourth Democratic challenger entered the Texas U.S. Senate race. Texas State Senator Royce West will run in the Democratic primary next year, hoping to face John Cornyn for his Senate seat in 2020. West has represented Dallas County since 1993. West Rappaport brings us a historic perspective of what these candidates will face.
And I'm ready today to announce my candidacy for the United States Senate.
Dallas lawmaker Royce West becomes the latest Democrat to enter the race for U.S. Senate. He joins a crowded field, including veteran and former House candidate M.J. Hager, who has raised the most money of any Democrat in this race.
We have so many people waking up and realizing that they can do something about the fact that they have representation that doesn't reflect their values.
Houston City Council member Amanda Edwards says she could be the David to Cornyn's Goliath.
I stand out from the pack because I am so focused on people and delivering results in their lives.
I say to Democrats and Republicans, I will be an ALBJ type senator who sits down and gets the job done.
Cornyn's challengers have a heavy lift. We looked back at the recent history of Cornyn's seat. The last Democrat elected to this seat was Lyndon B. Johnson, who took office in 1949. When he took off to be vice president in '61, a Democrat was appointed but lost the election to finish out Johnson's term. The seat's been held by Republicans since, and no incumbent that has run for re-election has lost. In Texas's other seat, it's a similar story. A Democrat from Texas has not been elected to the U.S. Senate since 1988, when Lloyd Bentsen won re-election. His appointed replacement lost the race to finish Benson's term, paving the way for Kay Bailey Hutchinson and then Ted Cruz. How many candidates are too many?
Yeah, jump on in. The water's fine.
Cornyn told me earlier this year he welcomes the challenge.
I think a contested Democratic primary would be a great thing, and I look forward to taking on whoever the Democrats nominate in the general election.
I'm Wes Rappaport for State of Texas.
The 2020 primaries are March 3rd. Former Democratic State Senator Wendy Davis announced on Twitter she's running for Congress in 2020. She's seeking Representative Chip Roy's seat in District 21, which covers part of Austin. Davis earned national attention in 2013 with her 13-hour filibuster on the floor of the Texas Senate, protesting a bill that would restrict abortions. She then won the Democratic nomination to challenge Governor Greg Abbott, but ended up losing to Abbott by more than 20 points. A key ruling ahead of the 2020 census. A federal court ruled Texas can change its voting maps without federal supervision, despite the court's grave concerns. It clears the way for Texas to enact new voting maps in 2021 without the courts checking to see if minority voters might be disenfranchised. A 3-judge panel in San Antonio voiced strong concerns given past conduct, but the judges said supervision is not warranted following a Supreme Court decision last year that kept the state's maps largely intact. Texas voters will see 10 proposed changes to the state constitution on the November ballot. The Texas Secretary of State's office drew the ballot order out of a hat in Austin. Among the measures, voters are being asked to decide whether to ban a state income tax, whether Texas should dole out billions more for cancer research, and how much of the state's sporting goods sales tax should go to Texas parks.
I want to impress everyone the importance of this election come November 5th, that Texans do have the ability to impact the way we function as a state, and it's very important. So we encourage all eligible Texans to register to vote.
Coming up on State of Texas.
I feel that's something that we have a common ground on, and if they hold them up to high expectations, so do I.
Before students can play, they've got to pass a drug test. A Texas school district's new approach to make sure students stay clean. A new push to expand drilling in the Gulf is sounding a familiar alarm for those who live along the coast and some lawmakers who represent them. And in the border report, how bridge runners are slowing traffic at busy ports of entry.
Sail into the Gulf of Mexico and you may soon see more of these. The Department of the Interior says it plans to lease an additional 77.8 million acres in the Gulf for oil and gas drilling starting in August.
It is a threat anywhere because you cannot ensure that those rigs will be safe.
Tampa Congresswoman Kathy Castor isn't happy with the announcement.
The BP Deepwater Horizon disaster proved the point that a spill anywhere in the Gulf of Mexico is detrimental.
But in a statement, Secretary of the Interior David Bernhardt says the Trump administration, quote, is laser focused on developing our domestic offshore resources in an environmentally conscious manner.
The department also says any project will also have safety measures in place to protect sensitive resources and mitigate any adverse effects on protected species.
We don't think the Trump administration is paying close attention to how the oil and gas industry operates in sensitive areas.
Ethan Manuel with the Sierra Club says environmentalists are concerned about a lack of oversight.
We still don't trust the oil industry. We're not sure they've learned their lessons.
And while the new leases will cover areas in the central Gulf, far from most coastlines, Castor says if there is a problem, the location may not matter, like when the Deepwater Horizon spill happened in 2010.
Even though oil didn't roll up on the shores of Tampa Bay or the Sarasota area, the tourists stayed away.
Reporting in Washington, I'm Trevor Shirley.
A school district in the Texas Panhandle will begin drug testing students as young as 12 years old. Bushland ISD, west of Amarillo, says students in grades 7 through 12 must pass a drug test before they are approved to participate in extracurricular events. Students will be tested for 7 substances, including alcohol, marijuana, heroin, and opioids.
What the district wants is to help our kids make better decisions, not make basically better decisions, but make good decisions. when it comes to drug use and those type things. It's not something that we feel like is a problem out here right now, but we want to be proactive.
The school has a 4-strike punishment system. After the first offense, students lose campus parking privileges and are barred from activities for 7 days. A second offense is 14 days, the third offense is 60 days, and the fourth 365 days. The Texas Education Agency says there are no state guidelines when it comes to mandatory drug testing, but random testing of student athletes is constitutional, as decided by the U.S. Supreme Court. Texas lawmakers spending tens of millions more to expand health care. Next, what the new money and the new laws mean for Texas doctors and patients. And Border Report, a new resource for real-time information about people living, working, and migrating along the U.S. border with Mexico. Texas lawmakers passed tens of millions of dollars to advance medicine across the state, and we're now beginning to see who will benefit and how. New funding includes a $68 million increase in women's health funding, $31 million more for early childhood intervention, a $50 million increase in funding for adult mental health services, $99 million to establish the Texas Mental Health Care Consortium, and additional $7 million to reduce maternal mortality and morbidity, and $5 million to integrate prescription monitoring programs into electronic health records. Here to help us learn more about what exactly all that money will do for patients and physicians is Dr. David Flieger, an Austin surgeon who's now the president of the Texas Medical Association. Welcome.
Well, thank you for having me.
Sounds like TMA did well with this legislative session. Talk to me about how all of the money that's coming out of what lawmakers did is going to help patients.
Well, several areas. So public health, rural health, mental health. So mental health's a big one, as you've mentioned. A lot of funding going into especially children's health issues. And we've obviously seen over the last few years that Texas has been deficient in that. And so we've got some major funding, consortiums being built that are going to help children and mental health, entire networks to try to help them with their issues.
Yeah, I think for a lot of people, they don't understand what the term consortium really is, but it's involving a lot of different higher education places across the state.
Exactly. We're talking everywhere from hospitals and hospital networks to medical schools to universities, etc. All be getting together to work on trying to coordinate and give Texas a good infrastructure for both mental health and specifically for children's mental health.
Now, we're also talking about young people on the physical side as well. The smoking age was raised to 21.
Yeah, that was a big win for the state of Texas. Tobacco 21, as it was known as, will basically make it harder make it so that you can't buy until 21. We know from studies that if you delay onset of smoking, then you're less likely to become addicted and you're less likely to have the obvious diseases. Ultimately, this is a bill that will save thousands of lives in the state of Texas.
Some things don't always pass, though. Surprise billing, talk to me about that. That was kind of one of those that a lot of people were wondering, is it going to go this way? Is it going to go this way?
Yeah, so that was one of those partial wins for us. As it first was placed before us, it was going to be very onerous for physicians as far as trying to deal with the surprise billing legislation that was proposed. Ultimately, what we came up with is very acceptable to the physicians of Texas. What we're doing is we're taking the patient out of the process. So now the negotiations will occur between the doctors or the hospitals and through an arbitrator, the insurance companies.
What happened to the funding increase for Medicaid eligibility for new mothers from 60 days to a year?
Yeah, so what we were hoping is 60 days to 365 days, because there's a significant number of issues that lead to maternal mortality during that period of time. We wanted that to go through Medicaid because that's a known set of benefits. Instead, it will be going through Healthy Texas Women, a state program, and through state funding. So $45 million has been put into that program. Our main concern concern is how this will come out in how the rules were written. It's certainly not as robust a program as Medicaid is, specifically regarding mental health issues and substance abuse treatment issues. And we're hoping that those will be beefed up a little bit in order to help these women.
What about the opioid epidemic? How did lawmakers try to tackle that this session?
Well, a couple things. Some of them are sort of dealing with doctors as far as we now have to go into a special data bank and evaluate how many narcotics a patient has received recently and from how many different doctors. That's been delayed a little bit because there's some problems getting our electronic medical records to talk to the state, and we're dealing with that. Other ways that we're dealing with it is there'll be a 10-day limit on how much narcotic one can give at a time, and we felt that that was a reasonable compromise as far as trying to take care of the patient's needs and at the same time not giving them too much medication that might be abused at a later time.
We have several physicians in the legislature this past session, particularly from here in Central Texas.
We do.
Don Buckingham,
exactly.
Donna Campbell, Charles Schwartner.
Exactly.
Does that help when you're having these conversations at the Capitol? Can they kind of rally their colleagues?
It does. It does. It helps us to. We speak the same language. There's a legislative language and a doctor language. They have to know both of them, so they help us to interpret. So it helps that. They can help us to put bills forward. But probably more important, their peers look to them because they know the medical issues. They know the science involved, and so we know that their other legislators are looking to them.
All right, Dr. Flieger, thank you very much for being with us.
Well, thank you. Appreciate it.
To the border now, where U.S. Customs and Border Protection officers are dramatically slowing down traffic coming in from Mexico. It's an attempt to stop asylum seekers from sprinting across border bridges in South Texas. They're being called bridge runners.
That is, you have some people that have gotten a little desperate, and they might be wanting to use a taxi or a car or just run across the bridge, and that means our CBP officers are now going to the middle of the bridge and sometimes stopping traffic because you have people that are trying to get in the middle of the bridge so they can then claim what asylum, credible fear, and all that. That's impacting our trade and tourism.
You'll find that story right now at our new website, borderreport.com. Read about the drastic changes and procedures happening at those international bridges. Borderreport.com is a joint effort by this local station and others owned by our company, Nexstar Media Group. Here's a behind-the-scenes look at that project.
We're really excited about the Border Report because it gives us a chance to tell local stories about people living, working, and migrating all along the U.S. border from Brownsville to San Diego. And so we think it's a really unique footprint that Nexstar has newsrooms and journalists positioned all along the border. So we're perfectly suited to be able to tell those stories.
You know, we're bringing decades and decades of experience, not just journalism experience, but experience living and reporting on the things that are happening along the border. The stories that you may not hear about in the national news because these are people who live here, they experience what it's like being in the border and can understand the people that they're covering.
We hired the most experienced journalists with Julian Resendez and Sandra Sanchez. Julian is in El Paso, actually covering the El Paso Juarez area.
I'm a product of the region. I've been working in Texas for most of my career. I have relatives on both sides of the border.
And Sandra will be in the McAllen area covering the border from those different points of view.
I came to call the Valley home. The Rio Grande Valley is a very special place. It's a very unique place. And it's a place that is not always understood by everyone.
And eventually we'll add reporters who are in the California border area as well. These are reporters who truly know the inside scoop on what's happening in those border communities. And when they start to talk about story ideas they have, you can see how passionate they are.
Obviously, I love doing immigration stories because I know that there's a lot of people that are either in an immigration process or know an immigrant. There's a lot of crime stories here on the border. And people need to know exactly what's going on beyond so many people were killed in Juarez or we had a robbery in El Paso.
the real stories, the family separation, the court hearings, the asylum seekers, the builders of the wall, the Border Patrol agents.
Actually dedicated one of our producers, Fernie Ortiz, who every day when he comes in, he actually calls some of the next star stations around the country, Albuquerque, Fresno, places where the border has an impact. And so to be able to aggregate that content and put it into one simple place where people can go online and find it all.
We do have these capital bureaus in these states that are along the border, and so they're dealing with border issues. And so being able to have someone inside talking to lawmakers, talking to the people in power who are making decisions related to the border. And what we're able to do is highlight certain regions. So California, New Mexico, Texas. We're talking about what's going on in Washington, D.C. But you can actually go to the region section and click through to see what the latest information is. So this is our live camera page, which has a number of different cameras set up right along the border, so you're able to see what life is like. Sometimes you're able to see the wait times at the border, you're able to see migrants crossing through. And all of these have captions and information about where these are.
This is a national story that's getting all kinds of attention from even around the world. And we want to make sure that we're telling the stories of the people who live here, the people who have been here for decades, and the people who have just arrived here.
There are so many components. This is the story of our generation. And I'm so excited to be part of telling it.
Thank you again for joining us for State of Texas. I'm Josh Hinkle. We'll be back next week to bring you an in-depth look at Texas politics.